I know we've done something similar like this, but I saw an article this week, and I was like, oh, I definitely got to like talk about this. And it was from BuzzFeed, and it was the 8 treatments or procedures that plastic surgeons say they would never get. And I was like,
Look at that, the picture of the butt. That's funny. Sorry, I don't know why I thought that was funny.
Yeah, it's a butt. And I was just wondering, would I agree with this list of things? And so I was going to kind of go through them because there's some like new stuff out there, right? So number 1 on this list.
BBL.
That was number 2.
Oh.
Buccal fat removal.
I sent you a meme. Did you see that meme that I sent you?
I did. That was funny. I was going to try to work that into the show. I should have worked that into the show. I missed the opportunity.
It was really funny.
That was pretty good. Yeah, I'll bring it. We'll bring it up next time. So Ziggy, are you familiar with buccal fat removal?
I am not.
Okay,
I would love
good.
to hear about it.
Excellent. So your buccal fat is your cheeks right here. And so some people, have full cheeks. And there's been this recent trend. It's really hot. In fact, I had a radio station call me this week, radio station out of Chicago, wanted me to talk about buccal fat removal. And of course, I told them I think it's a bad idea because as we age, our cheeks naturally hollow, okay? And that's what makes us look old. In fact, I do fillers for people to reverse that. If you go at age 25 and pull all the fat out of your cheeks to get that really kind of slim, I don't know what the word is, pointed or...
Gaunt?
Well, I don't think they're really going for gaunt, but yes, that is what it looks like. Then as you age, you're going to end up looking like Skeletor. Remember Skeletor from He-Man? Yeah. I was throwing that in there. So I'm really against this. And the only way I would ever be on board with this is if patients would agree to do just a very, very tiny amount, which they don't want. They want that dramatic look, right? And so that's why, even though this surgery is so simple that, I could almost teach anyone to do it, I just would never do it. It is a simple surgery, but, there's risks involved with it because you got your saliva glands there, your parotid glands, the ducts, you got these, your muscles that allow you to chew and eat. But then more than that, because that's just surgical technique, more than that, I'm just worried about what people are going to look like in 10 or 20 years. And then they're going to have to another procedure to fill their cheeks back up, right? I guess these doctors are doing it they're making sure they have business down the road because they're going to need something to fill those cheeks up.
Yeah, I don't like the look.
I don't either.
I think it makes, it looks, I guess.
It's defined, but I don't know.
I feel like if they wanted their cheekbones to be more defined, they should just use
something
makeup.
up top.
Yeah, that
or
too.
you could do you could even use
contouring.
makeup. We had a whole thing about the makeup and how you can
I don't know, ever since I was little, watching my mom or my sisters put on makeup.
Yeah.
Going like that, sucking in their cheek right there to put on blush and stuff, and that's the whole purpose is to make
that
Yeah.
Yeah, I'm not a big fan of those surgeries, so I would agree with that one. I would never do that. I would never want my wife or anyone I know to do it. Don't do it, Sarah.
I won't.
Yeah. All right, next was Brazilian butt lift.
Yeah.
I don't like those.
No.
Yeah, I'm not a fan of the Brazilian butt lift. Ziggy, Brazilian butt, you've heard of this, right?
Yes, Trey has mentioned it in the office. We've had long discussions about this.
So I'm really against those, even though I am a specialist in cosmetic body surgery. One, mortality rate 1,000 times higher than the average plastic surgery. What? That's crazy. Plus all the other complications that can come along with them. So I'm 100% on board with that. I'm one of the biggest.
Does it have a low satisfaction rate too?
Initially, it's pretty
would.
high.
Okay.
If you, it depends on when you ask people.
Yeah.
If you ask them in the first couple months, then it's generally pretty high, but further out, it starts to go down. Because the fat gets reabsorbed or it gets hard, and so And I don't have that exact data on that. I should look it up. I know initially the satisfaction rate is pretty high, but I'm more worried about are they happy a year down the road?
Yeah.
Because you don't want people being pissed off at you 9 months later. That's not good for anything. So yeah, I'm a big critic of Brazilian butt lift. I'm not the only one that. I wonder how many plastic surgeons are like me that just won't do it. I would say maybe 25%. I'm just guessing. I'm throwing a number out there.
Honestly, I think they look the most unnatural.
Yeah, to be fair, you could probably do a conservative one.
Well, yeah, I feel but when people get them, it goes.
And part of the reason is because they overfill it. The surgeons overfill it knowing that it's going to reabsorb.
Oh.
So that's why they look so just huge and round.
Yeah, well, to me, it's just, it always looks like your legs look like toothpicks, and then
Yeah,
you're like,
yeah.
what?
Yeah, I get I get like that kind of curved look that's like really in. Like, I mean,
Yeah, but your
nice.
it doesn't, it's just like, it's all of a sudden it's just like your legs are straight like pins, and then all of a sudden it's like whoop, ice, and then it's like ice cream cone style. Like, that's what it reminds me of. I'm just like, I
Then
can't.
have you draw a picture of what you think that looks like.
God.
I think she's painting a great picture
Yeah,
with words.
I
Just,
see.
it really does look like that, but
Yeah, I'm not a fan. So I
Me
agree with that one
either.
on the list. Okay, next was just straight up butt implants. I'm like even more against that. That's even worse than a Brazilian butt lift. Like those butt implants, they'll spin around, they get infected. Like, I mean, they're just no. I don't think they
around?
even. Yeah, because they're usually shaped, right? And so like they'll get going the wrong direction,
Oh
and the
my
butt
God.
looks like sideways or whatever. So as much as I'm against Brazilian butt lift, I'm even more against straight up butt implants. It's like one of the worst surgeries ever. I don't think anyone does them in the United States anymore. I mean, probably, maybe in Florida.
yeah, Florida.
Florida.
Sure.
All right, next was thread lifts. So
I saw an Instagram, Snapchat, like not, I think it was an Instagram video of like, I didn't know what it actually was. It's like,
was it coming out or was?
Yeah, they were like tight. They like were putting this thing and
Oh,
they
the thread.
tightening
Yeah, thread
it.
lift. Yeah.
It was so creepy.
So they were actually doing the procedure.
Yeah, and
Okay.
then there was a surgeon like you
Yeah.
that was just like saying how he hated this
Yeah.
surgery.
Yeah, I don't really care for them either. I would say it's lesser down on my list of hates. But the problem is that thread can get infected, and then like it's just a mess to try and get it out of there. Like the results are not always like, great. This is the whole cat eye thing. Well, the cat eyes they were doing was surgery or threading. I mean, I don't hate thread lifts. I would never do one personally. I would try to discourage someone from doing it, but like, there are worse things out there.
Yeah.
But I
it
do
just looked
agree that-
really weird.
Yeah, I'm not a big fan. So the next thing on the list was high volume liposuction. Now, it was kind of vague, when it said that. I would agree that high volume liposuction is a bad idea. And so to break that down, kind of like the hard cap, at least that we're taught in training for liposuction, is like 5 liters. You don't want to do more than that because you're putting fluid in, you're pulling fluid out, and when you do like these huge volume shifts, it can actually it can stress the heart a little bit. It's not necessarily healthy to get big shifts like that. Plus, really, like liposuction is not really a weight loss procedure. It's a contouring procedure, right? If you got like a little saddlebag or like a little pooch, then liposuction's perfect. You go in, you suck it out. It's not really designed to like try to make you skinny. Like that's not the design of liposuction. So, for me, I very rarely get up even to like, maybe 2 or 3 liters is kind of my max personally. So, they didn't really say what high volume liposuction meant. I would assume they mean 5 liters or more, at which point I would 100% agree, I'm kind of conservative though. There's other people out there that probably do 4 or 5 liters or up to 5 and patients do all right.
Yeah.
It's not me. I'm the safe guy. Like, I just don't want anybody to have like a problem that was due to like bad decision making, right? Even like being very careful, people can have complications. Like I had a girl the other day that was like 2 weeks out and had a bleed after implants. Like 2 weeks is crazy, and everything's really straightforward and it sucked, but we got her, we got her fixed. But you definitely don't want to like push the limits, to where you're increasing the risk of complications.
Yeah.
That's just silly in mind. So I kind of agree with that. All right, next, lipodissolve.
Never heard of it.
So it's basically using medications or chemicals you inject into the fat to dissolve them.
Oh.
Yeah, I'm not a fan of that either. Like that just is potential for problems. Like, there's no control, I don't think, with something like
Yeah,
that.
sounds pretty
Yeah.
out of your hands.
Of the things you've listed so far, that's the one where it's like, this just sounds like a bad idea.
I'm going to take this acid, I'm going to inject it into your butt, and we're going to hope for the best.
Yeah.
Like,
Hopefully it doesn't attack your muscles or your bones.
hopefully it doesn't rot your spine out.
Yeah.
No, it's not quite like that dangerous. It is a thing that's out there. I would never do that. There's like just safer ways to like go about getting rid of fat.
Like exercise.
That is a good one.
Yeah.
It's a good one. Yeah. All right, next. This one just on the next one, I wrote one word: idiotic. All right.
Oh, cute.
Yeah. So this is breast saline injection. Now, not saline implants, but me taking a big needle full of saline and injecting it into your breast to make it bigger. Yeah, idiotic.
That's allowed?
I mean, if you sign a
That
consent
sounds like that
form,
thing-
like, I mean, pretty much anything's allowed, right? I mean, that's why we can't like get rid of
That
these
sounds-
non-plastic surgeons doing plastic surgery.
That sounds like that thing that Cardi B was talking about, how they were like
Right.
injecting
Okay. So that was
stuff into
silicone.
her butt,
Right.
to her butt.
This is saline. So the thing about
Okay.
the saline is, one, it's infinitely
Salt water,
less
yeah, yeah.
harmful than silicone, but it gets absorbed in like less than 24 hours. So it'd be like if you had like a big date and you want bigger boobs for your date, but you don't want to have surgery, then you can get them injected with saline and they'll swell up for like 12 hours, but then it goes right back down. I mean, who would pay for that? And who would do it? Like, I mean, you're injecting someone with a needle for a result that lasts 12 hours. It's just crazy. I don't know.
It's like a Cinderella
I mean,
boob job
right. It's like, where did it go?
at midnight.
Where's the
Okay.
glass syringe?
At midnight, it's the glass syringe. At midnight, like it's like you turn into a pumpkin. Well, and at first I was like, I mean, are people really doing this? Like, I just can't imagine that someone is out there like advertising that they would do it. And then you think about all the stories that we talk about where
Likely.
it's like, yeah, I could probably imagine somebody's doing
Florida.
it. I doubt it's a plastic surgeon though.
Yeah.
I would hope that a plastic surgeon would not do something so foolish, but I don't know. All right, last ones. This is a big one. Penal enlargements.
Cute.
Yeah. So they're using dermal fillers, so like Juvederm, to inject into the penis to make it bigger.
Have you ever done a surgery for your penis?
No. I mean, I've done like, I've done like reconstruction stuff.
Okay.
But not like cosmetic stuff.
Yeah.
Yeah. I mean, I had a guy that remember the flesh-eating bacteria stuff?
Yeah.
Yeah, we talked about him.
Yeah.
Yeah. So, I mean, that guy lost his penis, but I've had other ones that didn't lose it, and I had to like do skin grafts and stuff. Yeah.
Yeah.
But like, no, cosmetic penis surgery is out for me. Like, I'm not doing that. Yeah. And injecting fillers into your penis, man, it's just hard for me once again to believe that kind of stuff happens, but then it's like, it does. I mean, so yeah, I would absolutely not.
It exists.
I would not
somehow.
do
We're
that.
talking
I
about
wouldn't
it,
have
so
it
it
done.
happens.
I wouldn't do it to someone else. I wouldn't want to see someone do it. I'm out on the penis injections.
I would want a second opinion.
Yeah,
I
right.
think.
If somebody tells you you need a penis injection, you need to like find another doctor.